So in this example, we're pretending that my injured leg is my right side, or the one I just had surgery on. What we're doing is we're gently getting the leg closer and closer to more knee bend or more knee flexion. A lot of times after surgery, it's stiff and it's hard to get it to bend. So I'm using my left leg to completely support my right leg. My right leg is completely off right now. This guy has no energy going through it, no active contraction. I'm using my left leg to slowly let my right leg bend. I'm probably gonna reach that point where I'm like, oh, that's probably where I feel some tightness, maybe some discomfort. Hang out here for a couple of seconds if I want, and then I'm gonna use that same left leg to bring it back up. So my right leg is just going along for the ride. It's not actually doing anything. My left leg's doing all the work, exposing it to that bend, feeling the stretch, coming back up again. In this exercise, I'm letting gravity help me increase my knee bending. So you want to be on some sort of a slippery wall, a wall that's going to slide. That's why I'm using a towel here. If you're on another wall that wasn't brick like this, it probably would just slide with my sock. So I'm completely relaxing my leg. Gravity's going to bring it down. There's going to be a point, which is why we're doing this exercise, that it's going to start feeling a little stiff, a little uncomfortable. I may want to hang out there for a little bit. And then I can either use my opposite leg to push it up, or depending on what your instructions are, you can kick it back up on your own. It's all going to depend on kind of what your post-op instructions are from your surgeon and your PT. You're going to feel a little stretch, letting gravity take it down. I'm not pulling it down actively. I'm completely relaxing it and slowly letting gravity take it down, nice and controlled.
Here's a body on knee exercise to help with knee bending. So this is the affected leg that we want to stretch. Go ahead and lift it and allow your leg to go ahead and bend as much as you feel comfortable. Once you find that point, what you can do is start scooting towards the edge of the chair. So go ahead and help with the arms, lift your body up, and scoot towards the edge of the chair. What you're doing is actually putting your knee in relative knee flexion, which is knee bending. So the leg is staying steady, but you're moving your body on your leg to get a little bit more bending. And then wherever you feel like is your end, go ahead and hold that position. It should only be mild discomfort. It shouldn't be too much pain here. And as you feel comfortable, you can go ahead and keep stretching into it. For this exercise, you're going to use a strap. You can use a towel, but you're going to wrap it around your foot and then hold onto it with both arms, and you're going to bring your foot back towards your butt as far as you can. So you can see how this is a knee bending exercise. And then you're going to allow the knee to straighten out again and then pull back. And when you pull back, you may need to choke up the band a little bit so that you can keep pulling. And try to bring that heel as far back towards your butt, basically. And then come back, just a passive stretch. You can keep the left leg relaxed here. My arms are doing all the work. And if you can, and you can bring it all the way back like this, you can even start leveraging your arms and cradling your lower leg here to pull this even more so. But you don't have to do that if you can't get there. Really leverage the strap and then come back. Really, goal is to try to bring that heel towards your butt as far as you can.